Hello, everyone. Welcome to Medicare 101. Thank you for joining us through this Facebook version of it. Usually they're in person, but with the COVID-19, we're doing it on Facebook. So welcome. And my name is Jim Langan. I'm a volunteer Medicare counselor, and I'm going to go ahead and share my screen now. So we'll get that out of the way. And at this point, you should, I hope, see my PowerPoint presentation, and I'm just going to move forward on that. And Amber, if there's any kind of problem with this or people aren't getting it, jump in and let me know. So anyways, this is Medicare 101. My name's Jim Langan, and I'm an OSHIIP volunteer counselor. So OSHIIP is the Ohio Senior Health Insurance Information Program. It's run by the Ohio Department of Insurance. And the purpose of it is to help people understand Medicare and get Medicare questions answered and know what their options are and so forth. And the information we give is free, unbiased, and objective. And it's free and unbiased because we don't work with any kind of broker or any insurance company. And with OSHIIP, it's under the Department of Insurance. So that there's actually employees of the Department of Insurance who work in Columbus, and they have a help desk. And at this help desk, you can call it. The number's on the screen here. And this number will appear other times in this presentation. So if you don't get it written down here, that's fine. But anyways, they will answer your Medicare questions, and they will also do counseling. So you can call them for a phone counseling. Then there's also like volunteers like me. We usually work in the county that we live in. And like for me, I work with some senior centers and libraries, and I'll give presentations like this, and I'll have counseling sessions, individual counseling. And later on in the presentation, I will show you, how if you did have questions or if you wanted to have a counseling session with me or ask me something, I'll let you know how to contact me, and that's later on in the presentation. So, the first thing we want to talk about is, sorry about that. We want to talk about what is Medicare. And so Medicare is government insurance is for people who are over 65 for the most part, although some people who are disabled and already receiving Social Security benefits because of that disability, they can be on Medicare also. And people with end-stage renal disease, no matter what age they are, they can be on Medicare also. So Medicare, when it was first developed back in like 1965, it never was intended to cover all medical expenses. First of all, something has to be medically necessary to be covered by Medicare. And the other thing is there's copays. It was designed to have copays where Medicare pays part and you pay part. And if you have just original Medicare, the copays are usually of 20%. So Medicare pays about 80% of a doctor bill, and you pay about 20%. And 20% sort of could get pretty expensive though. If it's a very expensive procedure or you have quite a few procedures, that could get fairly expensive. So people are interested in getting additional insurance that helps cover that out-of-pocket expense that you would have if you only had original Medicare. So most people, when they have Medicare, they have Medicare where they work with the government, but they also get additional insurance, an additional insurance policy from a private insurance company. So when you say you have Medicare, you're working with Medicare and also private insurance companies. And that's what we're going to talk about today. We're going to talk about your options of, well, how to do Medicare, and also your options of what that additional insurance is like. There's really two main approaches to getting this additional insurance. There's option one and option two. And with option one, you would get original Medicare, and you pay a premium for Medicare Part B, by the way. So you get Medicare and you pay a premium. And then you'd also go to a private insurance company to get secondary insurance. And the secondary insurance is designed to work with Medicare and help pay some of that out-of-pocket expenses that you would have if you only had original Medicare. And when you use option one, you'd also get a prescription drug plan from a private insurance company. The other option is option two, and that's a Medicare Advantage plan. So when you have a Medicare Advantage plan, you still sign up for original Medicare, you still pay your premium, but then you would contract with a private insurance company who sells a Medicare Advantage plan, and that would be your main insurer. When you have option one, you'll have like 3 insurance cards that you show your doctors and pharmacies and so forth. You have original Medicare cards, you'll have a supplemental insurance card, and you'll have a prescription drug card you carry in your wallet, and you deal with those 3 companies. With option 2, you just deal with the one company. You deal with the Medicare Advantage company. You have one card, and it covers all hospitalization, medical, and prescription drugs all in one plan. And the big overlying difference is, like with option 1, the premium's usually a little bit more expensive for a supplemental insurance plan than it is for a Medicare Advantage plan. But it covers more, and you rarely have out of pocket when you use option 1, you rarely have out of pocket. With option 2, the premiums are a little bit less, but it's designed to have out of pockets as you go. So it's kind of a pay as you go system. I'm going to go on to the next screen here. And so how do you enroll in Medicare, and when do you do it? Well, first of all, I wanted to say you actually enroll in Medicare with the Social Security Administration, believe it or not. So you contact the Social Security Administration and you sign up for Medicare with them. If you're already receiving if you're already receiving Social Security benefits, you will automatically get enrolled in Medicare. Social Security already knows about you if you're receiving benefits. In about 3 months before your birth month, right before you turn 65, they will send you in the mail your new Medicare cards that take effect the first of the month where you were born. Okay, and you take that card and you hold on to it for 3 months, and that becomes your medical card going forward if you decide that you want to go on Medicare. You also could decide to hold off on Medicare, and we'll talk a little bit more about that as we work through this slide. Now, if you're a person who is not receiving Social Security benefits when you're approaching 65, they will not sign you up automatically. They will not enroll you automatically, and you need to proactively apply for Medicare. And you do that, like I said, with the Social Security Administration, and you can do it. It used to be you could go in person, make a phone call, or do it online on ssa.gov. Now with the COVID-19 situation, the offices are closed and you cannot make appointments and go in person anymore. So what you do is you call Social Security, set up an appointment for a phone meeting, and you can, they will do a phone meeting with you to apply for Social Security, or you can go on to ssa.gov and sign up on ssa.gov. Now, when do you do this? There's a 7-month initial enrollment period. It's 3 months before your birth month when you turn 65, the month that you turn 65, as well as the 3 following months. That's when you need to sign up for Medicare. And you really want to keep an eye, if you want Medicare, you need to keep an eye on that and make sure you sign up during that initial enrollment period. Don't miss that one. There's some reasons why you don't want to miss it. One is coverage, and the other one is a financial thing. So if you don't sign up during your initial enrollment period, you cannot sign up again until the next January. There's kind of an open enrollment period in January, and you can sign up in January. And if you do sign up in January during that open enrollment period, your Medicare doesn't take effect until the following July. So there's a coverage gap. So if you're going to need Medicare at a certain point, you're going to need to make sure that you sign up. The other is a financial thing. Remember I mentioned that there's a premium for Medicare Part B. Well, if you don't sign up during the initial enrollment period, you get penalized. So that premium, you get a 10% penalty on that premium for every year that you don't sign up. Okay, so you really want to keep an eye on that so that you get signed up during the initial enrollment period, and that you don't get a penalty, and that you don't have a lapse in coverage. Now, the other thing is, and you know a lot of people like this, maybe you're one of them, you don't have to sign up. If you're still working and you have a group insurance plan from your employer, you don't have to sign up for Medicare because you have, employer group coverage. Or if your spouse is working and your spouse has coverage from your employer, if that's the case, you don't have to apply for it. and you don't have to take it until that coverage ends. So whatever year in your life that ends is when you would actually do the applying, and that's called a special enrollment period. So a special enrollment period is for people who have employer health insurance either for themselves or their spouse, and don't apply till after they're 65. And you won't get penalized because you do have insurance. You want to make sure that you have that proof of insurance, but you won't get penalized. And at that point, there's a special enrollment period, and you have to sign up during the special enrollment period. It's 6 months after that insurance ends, or anytime before the insurance ends. So if you know you're going to retire, or you know that insurance, you're going to leave that insurance for some reason, you can actually apply for Medicare before that and have it start the first of the month where your old insurance ends. And that's when I counsel people, I recommend them to do that. And I also counsel people, for those people who are turning 65 who have to apply with Social Security, I recommend that you apply 3 months before so that you get it set up. If there's any questions or issues, you can work through those, still get the insurance on the day you need it. And we talked about that additional insurance, like the drug coverage and the supplemental or the Medicare Advantage. You need to have your Medicare number and be enrolled in Medicare before you can actually get that additional stuff. So start this 3 months beforehand, and it gives you time to get your other coverage lined up so that there's no drop or gap in coverage when your current coverage ends. I wanted to say one thing here. I'm not going to talk about it too much. And if I'm going to give you my email later, and if you're a person that falls into this, if you have a question and you want to email me with a question, you can. But what I wanted to say is, if you're a person who has your employer's insurance and you're going to work past 65 and it's group coverage, and it's actually a high deductible plan, and you're contributing to an HSA, if you do that, you want to make sure you don't apply for Medicare at all. And you also want to stop contributing to the HSA 6 months before you move over to Medicare if you're going to go to Medicare during the special enrollment period, because there's a law. It's a tax law where you cannot contribute to an HSA if you have Medicare. So you want to make sure you get around that. You can work with your tax preparer too; they understand those rules. But if you have questions on that, you can definitely ask me sometime. All right, this is just because of the COVID-19. It's a little bit of information about the Social Security Administration, and I kind of mentioned all this already, so I'm going to move on. And what I want to do now is talk about Medicare Part A and Part B. So original Medicare is made up of Part A and Part B, and Part A is like inpatient hospitalization. So if you're an inpatient patient, and an inpatient, by the way, that's a specific category that it's an official status for you when you're hospitalized, and they say that you're inpatient. If you're inpatient, it's going to be covered under Part A. And if you're not, and like if let's say you're in for observation, or you're in the emergency room, or maybe you're getting some kind of outpatient surgery, that's covered under Part B. So either way, when you go to the hospital, it's going to be covered under Medicare. But I want you to be aware whether it's like an inpatient stay or not, because Part A and Part B work differently. And when you get a bill, or when you get any questions from the hospital or Medicare, understanding whether it's Part A or Part B will be good to know, because the insurance works differently, and they pay out differently. And we'll go over that on the next slide. So anyways, Part A is for inpatient hospitalization, skilled nursing facilities after you stayed in after an inpatient stay, home health care after an inpatient stay, and hospice. So those are covered under Part A. Part B is everything else. It's outpatient, doctor's visits, preventative visits, diagnostics, durable medical equipment, which is like canes and wheelchairs and so forth. And that's all covered under Part B. So I have here a list of some of the things that are covered under preventative benefits. And the reason they have this slide here is because preventative benefits are benefits where Medicare is designed to not have copays, because they want you to do these preventative things. So they don't have copays in them. And Medicare likes me to have this slide. You can get more detailed information on this in other places. And that's where I'm going to take now that we're on the slide, I'm going to take this time to go over a couple of places where you can have where resources that you can use to get more information about this, as well as everything else about Medicare. So a really good place is, those of you who are already on Medicare, you get a book called Medicare, Medicare You, and I'm going to hold it up. It looks like this. And it has a whole bunch of detailed information about Medicare. And I recommend when you get that each year, you look at it. Another really good place is, this is a booklet that I use. This is Medicare 101 booklet by State of Ohio, puts it out. I usually pass this out when I do the in-person presentations, and it's just a book you can carry with you or keep with you, like at home after this presentation, and review things. Or if you're a person who's new to Medicare, you can look at that and remind yourself some of the things that were said in this presentation. I usually pass it out in person, a hard copy of it. Couldn't do that this time. So what I'll do here is later on, I'm going to show you my email address. And if you would like one of these, I can send you via email. I can send you a electronic version of this in a PDF. And then finally, there's Medicare.gov. Medicare.gov is a really good website. And when people are new to Medicare, I recommend that they go to that and look around there and learn everything about Medicare. There's a whole bunch of stuff that's really good about Medicare there, and you can learn a whole bunch of stuff. And they can clarify if you're not sure about a small question like a limit on copay or something. That all is in Medicare.gov. So you go to Medicare.gov and look at that. And that's a really good site. I recommend it for people who are new to Medicare. And if you're already on Medicare, you can look at it and, review of some stuff on there. Okay, so the costs for Medicare. Medicare Part A is remember, that's the inpatient hospital insurance. The monthly premium is $0 on that one. So you don't pay a monthly premium as long as you've paid into your payroll taxes, your Social Security, as long as you paid into that for 40 quarters during your career. Part A is free. If you haven't worked 40 quarters, but your spouse has, it's still free. You can declare spousal benefits and get Part A for free. And if you have not worked 40 quarters, your spouse hasn't worked 40 quarters, there is a premium. The premiums are here. They're also in Medicare.gov and Medicare 101. And certainly the Social Security Administration will tell you about what those premiums are when you sign up. Also, besides having a premium or no premium, they do have a deductible. So with Medicare Part A, you have a deductible, and it's based on a benefit period. And a benefit period is a stay in the hospital. So in the Medicare Part A inpatient hospital world, a benefit period is a stay in the hospital. I know we're used to a benefit period being like January to December, but in this case, it's a stay in the hospital. So if you have a stay in the hospital as an inpatient patient, you have a $1,400 deductible. Regardless if the stay is 1 day, 5 days, 10 days, whatever, it's still $1,400. You pay the first $1,408 before Medicare benefits start kicking in for Part A. Also, I wanted to say that if you're discharged from the hospital and you come back to the hospital within 60 days and have to be an inpatient again, that's part of that original benefit period. So you don't get charged another deductible. But however, if you're discharged from the hospital and you come back after 60 days, that's another stay in the hospital, and that's another deductible. So you can see that with this deductible on Part A, it can get kind of expensive if you have a difficult medical year. And that's why people, again, are interested in getting that additional insurance, which we're going to talk about, on future slides. Also, besides the deductible, if you stayed in the hospital for more than 60 days, a copay kicks in. And again, another reason why you want to have some of that additional insurance to help pay those out-of-pocket expenses. skilled nursing facilities, the first 20 days are free as long as you are, as long as you had been in the hospital as an inpatient patient for 3 days. The skilled nursing copay is nothing for the first 20 days, and after that there is a copay. So a skilled nursing facility, that's not a place, like again, I wanted to say, that's not a place you go to stay for the rest of your life. It's a facility you go to for rehabilitation after staying in the hospital. So maybe you had a hip surgery, not quite ready to go home, don't need to stay in the hospital anymore. You go to the skilled nursing facility to get rehabilitation for occupational therapy and physical therapy. Okay, Medicare Part B has a premium of $144.60. So that's for everybody. Everyone pays that. There might be a small exception for somebody who's been on Medicare and Social Security for many, many, many years, and there's some loophole where they're not paying the $144.60, but almost all of us are. It's also based on income. So if you have a higher income, and I didn't list the numbers on here, but they are on Medicare.gov in the Medicare 101 booklet and also in the Medicare You book. But if you're at a certain level of income, you do pay a higher premium. And that premium, and that's based on your income from like the tax return from 2 years ago, because that's the most recent tax return on file in January is from 2 Januaries ago. So it's based on that, and they recalculate that every year. So Social Security will look at your tax return every year and decide if you have to pay an additional amount. There's an annual deductible of $198, and what that means is you pay the first $198 for Part B services before benefits kick in. And once benefits do kick in, generally Medicare pays 80% and you have about a 20% copay. So that's the 20% copay, that's another reason you'd want to have that additional insurance, which we're going to talk about in a little bit. All right, I'm about done here. I just wanted to say one other thing. If your income's below a certain level, you can get extra help from Medicare, and depending on your income and your resources, you might qualify for this extra help, and they will help pay your Part B premium as well as help pay some of the out-of-pocket expenses. So if you look at these numbers, if you look like you're close, make an appointment with me and I can help you, give you some advice on how to apply for it. Or you can call OSHIIP and that number I gave you, which will be later. Or you call Job and Family Services, which is the people that do Medicaid. And those are actually the people that process this. So that would be the way if you think you're going to fall into this category. I'm going to skip this slide and just go on. So we're ready to go on to the supplemental plans now. And usually at this point, I don't know how this will work. I haven't done one on Facebook like this live. And I wanted to ask if there were any questions. And let's see if I can do that. Amber, are there any questions that would relate to this, or do you want to hold those till the end? We can do that. Okay, I was just looking at chat. I see no questions there, so I'm going to assume there's no questions on anything I talked about for Medicare earlier, and I'm ready to go on to the Medicare supplements now. So we're gonna start talking about option one. So option one, you get where are we? Sorry about this. Option one, you get Medicare, like we talked about. You sign up for Medicare Part A and Part B, and then you find a secondary insurance plan, and that's what we're going to talk about now. And there's a couple of things I wanted to say. You can get the secondary insurance in a few ways. I'm only going to actually talk about the Medicare supplemental insurance in detail, but you can get it. You can get group health coverage and Medicaid coverage. So group health coverage, that's for like when you're retired and an employer or maybe a union offers you a group health plan that's designed for people who are over 65 and who are on Medicare, and it's designed to work with Medicare as a secondary insurance, but it's provided by your group plan. And it's not something people can go out and buy on the market. It's specifically designed by that company and an insurance company who processes it for them and gets approved by Medicare. And then that's your plan. So those plans often offer it. They often subsidize the premium, and if it's offered to you, usually that's a very good plan for you. And those plans also usually offer prescription drug coverage, which is, good creditable coverage, and you don't have to get prescription drug coverage. So that's usually a good plan for people where that's offered. The other thing is Medicaid. I'm not going to talk too much about that, but we're talking about Medicare. This is Medicare we're talking about for people over 65, no matter what your income is. Medicaid is for people who have low income, no matter what your age is. So if you're under 65, Medicaid is your primary insurer. But once you get over 65, you still need to sign up for Medicare, and then but you might qualify for Medicaid because you have low income, and Medicaid becomes your secondary insurance, and that's a place that would help you pay the out-of-pocket expenses. What we're going to talk about in this segment, though, is Medicare Supplemental Insurance, and these are plans that are designed by Medicare, and they're offered by private insurance companies, and they're designed to work with original Medicare. And there's 10 standardized plans that are offered to people, and you decide which standardized plan you want. And I'm going to move on to the next screen here. And the plans are named A through N. Not sure how they got these letters, but they're A through N, and these are the 10 plans that you can get. And the plans are standardized, so no matter what insurance company you pick, a plan is the same for the other as it is for the other insurance companies. So for example, if you pick a G plan for company 1 is the same as a G plan for company 2. It doesn't matter which company you pick, the benefits are going to be the same. The only difference is they might have some other differences, but the main difference might be that the premiums are different. The plans don't all charge the same amount. So you're going to see in a slide or two up ahead that the same plan costs different prices for different companies. And that's one of the things you will use when you decide which plan you want to pick, which company you want to pick. Okay, the big thing about getting a supplemental insurance plan is that there's no network. So you can go to any doctor in the country. When we talk about Medicare Advantage, you're going to see that there's networks, and you're restricted to only go to doctors who are in that network. But if you have Medicare and you take a supplement, you can go to any doctor in the country. So that's a really good feature for people who travel a lot, for people who have a second home in a different part of the country, or people who have health conditions where they go to different doctors that might be in various networks. It does not include drug coverage, so you will have to go pick a separate drug plan. And it says, this next bullet point says it pays only after original Medicare. So let me explain how this works a little bit. So when you go to a doctor, you're going to show him your Medicare card, and you're also going to show him your secondary insurance card. So the doctor's going to submit the claim to Medicare first, because Medicare is the primary insurer. Medicare will adjudicate the claim, and they will pay the doctor what they're supposed to, which would probably be like that 80%. And then the bill behind the scenes, this bill or this claim will go to the supplemental insurance plan, and they will pay whatever they're supposed to pay based on the plan that you have, and the doctor will get paid by them. And then, and only then, would the doctor maybe bill you. So a lot of times the doctor doesn't bill you. So when you have these kind of plans, you don't get many bills from doctors, and sometimes you get no bills from doctors because everything's covered. There's another concept I wanted to tell you about that you have to keep in mind. Remember I talked about the initial enrollment period, make sure you get signed up at the right time. Here's another one. If you're going to pick a supplemental plan, there's a guaranteed issue, which means that they have to take you. An insurance company cannot turn you down. So even though a private insurance maybe would only want to take healthy people and young people, in order to offer a supplemental plan, Medicare forces them to have a guaranteed issue period. So for 6 months after you turn 65 and get on Medicare Part B, there's a guaranteed issue period where whichever the insurance company whichever insurance company you pick has to take you. They can't turn you down for medical reasons, for medical underwriting. And they can't charge you more because of medical conditions. They have to charge you what they charge everyone else your age, and they have to take you. So that's a really good thing, but it's only during that 6-month period. So if you're going to get one of these, you have to make sure you sign up in a timely manner. And again, when I counsel people, I usually counsel them to do this before Medicare even starts. So you get on Medicare 3 months before, and then you get on this as soon as you can. So that's all set in place before you turn 65 and Medicare starts in. There's also special circumstances. So there's special circumstances where you have guaranteed issue, and that would be if you are already on a plan and that plan goes out of business. Well, there's a 2-month period after you're dropped by that other plan. There's a 2-month period where these plans have to take you. So you can't take a plan and have them go out of business and you be out of luck. They do have to take you. Another example would be that employer plan I just talked about a screen or two earlier, where your former employer actually offers you a plan for Medicare people. Let's say they go out of business, not go out of business, but they decide to not offer it anymore because it's too expensive for the company, or they're asking you to contribute more in the premium and it gets more expensive, and you'd be better off going out on the market and getting a standard plan. If you have to leave that one, you have the 2 months 2 months to join a new plan, and you have guaranteed issue. And another final example that I can think of would be maybe if you move to a different state. These plans are not offered in all states. So if you move to a different state, you would have a option to pick a new plan, and they have to take you. So here's a screen. I don't know how it's showing up on Facebook or anything else. I just know on my screen it's very little, but I wanted to show it to you. It's actually from the Medicare 101 booklet. But this information is something I want you to see. So bear with me, even though it's kind of a cramped up here. These are the plans across the top are the A through N plans that I said are the standard plans. And down the left-hand side, these are the different possible out-of-pocket copays that you might have. If you have original Medicare, these are the possible out-of-pocket copays. And the check marks say which of these the plan pays for. So the more things they pay for, the more expensive the plan, and the less expensive the plan, probably the lower the benefits. But right now, the G plan and the N plan are the most popular plans. So we have a G plan, and if you look down the G plan, you can see that there's a check mark in every column except for this one, which is Medicare Part B deductible. So that means if you got a G plan supplemental, anything that Medicare didn't pay and left as an out-of-pocket for you, your G plan will pay it, except for the first $198 in that deductible. So if you had a G plan, your only out-of-pocket would be $198. Now those are pretty good benefits, and the G plans are a little more expensive than the other popular plan, and the other popular plan is the N plan. Between those two plans, most of the people I counsel have these two plans. And it looks a lot like the G plan because it doesn't pay the deductible, but also if you look at the copay part under Medicare Part B coinsurance, you have to pay a $20 copay for an office visit and a $50 copay for an emergency room visit. So the benefits aren't quite as good as the G plan, and the N plan then of course also has a little bit of a lower premium. And as we look at the premiums, you will see that. So your thing, if you're going to go this way, you've got to decide which plan do I want? Do I want a G plan or an N plan? Or any of these other ones you actually could pick, but most people do the G and then the N. And then it's like, which company do I pick? So I'm going to go to another slide here. And this is also from the Medicare 101 book. So if you really want, if you would like, don't hesitate asking to have this book sent to you. Inside the book, there's about 6 pages of this. These are the 50 different plans that offer supplemental insurance in Ohio. Okay, I'm just showing the first page on this slide because we're not going to study it, but I wanted to give you some information about it. So of course, the plans are going across here, across the top. They're the 10 plans. And then down the left-hand side are the companies and their phone number and their web address. So you would contact these guys by going to their web address or calling them on the phone and signing up with them. So when we get to talk about the drug plans and we talk about Medicare Advantage, those are plans that I can help you sign up for, and you can actually sign up by yourself. With these supplemental plans, you need to actually contact the insurance company or a broker in order to buy these. So you can contact them through the phone or the web address, which is what I did when I signed up, or you could actually work with a broker. A broker is a salesman who sells for multiple companies, and he can help you get signed up and help you find the best plan for you. A lot of people many people consult, like have me advise them, and I help find the best plans for them, and they go and they sign up on their own. Other ones find out what I say is the best plan, and they still call like a broker or a salesman and make sure that his information is correct and have him help them sign up. And I like a kind of a variation on that. Some people actually go to a broker, find out what they have to say, and then they'll ask me if that information is right, and then they'll work with the broker to buy the stuff. So for this, you can work with a broker, but you don't have to. You can work directly with the company. But let me go over what I wanted to show you on this one was the prices. So this thing here is in alphabetical order. So AARP is the first plan on this one. And remember, like I said, there's 6 more pages of this. But if you look at the G plan, which I talked about, it's $124. I know you can hardly see that there, but it's $124 for AARP, and their end plan is $103. So the end plan is a little cheaper in premium, and the benefits are a little bit less. So so that's kind of gives an example of what prices are between the different plans here. And these are not, if you went to buy it today, these would not be the exact numbers. This is just as these numbers were when this book was printed. And the way the Department of Insurance gets this information is the Department of Insurance sends out a survey to all the people who sell supplemental plans in Ohio, and they just print in here what gets returned to them. So this is what the insurance companies returned to them. And this is whenever they did this, which was back in, I'm guessing this was like several months ago. So your prices will not be exactly like this for sure. All right, the other thing I wanted to show you is we look at this G plan, and AARP, theirs is $124 a month. This next plan, which is Aetna, is $105, and then the next guy's $94, then $145, $141, $161. So you can see the prices are all over the place on this one. So price is one of the things you'll want to look at when you pick a company. It's an important one. So you'll probably try to find plans that have like the lowest prices. There's a few other things that you want to look at too. They offer some benefits like a household discount. So some plans, not all of them do it. Some plans offer a household discount, and the household discount is usually either 5% or 7%. So if second person, usually your spouse, gets insurance from the same company, you would get that 5% or the 7% discount. So you want to find out from the plan if they have a discount. And you could do that by just going on their website or calling them, talking to a broker. And by the way, I can also help you with this plan. I mentioned earlier that some people come to me for advice. I have an application that when I'm counseling someone, I can see the prices and other information about these plans that it's not public, but it's available to us OSHIIP counselors, and I can help you with that. So I could tell you the price, and I could tell you if they have household discounts. They also offer other perks such as like a gym membership. There's other information like financial health. There's financial companies that rate these insurance companies for their financial health and give them ratings. And that might be something you'd want to look at to see if the plan you're picking is financially healthy. Some other information that's available is their rate increases over the recent years. So you can find out how their rates have increased over the last few years. Doesn't mean that it's always going to continue in that way, but it is some information that you can use. And rates go up for a couple of reasons. One, they go up every year as you get older. So as you get older, your insurance definitely is going to go up for age. And what I'm showing here is what it's going to cost when you're 65. So if you're over 65, it will be more than this. And it also goes up in general for inflation. So not only does it go up for your age, but the general baseline goes up. So a 65-year-old, like in 5 years, like this year they're paying this much, in 5 years, their rate still is not going to be 124. It's going to be higher for a 65-year-old. So the base goes up, and then also it incrementally goes up as you age. So those are the two factors that you'll see. And some companies raise their rates once a year. Other companies, you're really lucky, they get to do it twice a year, one on your anniversary date and one at the beginning of the year or something like that, or their fiscal year. So you want to get that information. And a lot of that I can help get for you too. A broker definitely can get it for you, and you can get it by talking to them on the phone or on the internet address. And the good thing here with this book is these are the plans that are offered in Ohio. So you can actually see on these 6 pages in the book which plans you might want to check out. I think that's it for supplemental insurance. And again, normally I will stop and ask if there's any questions. And, you know, if you want to let me know if there's any questions, you can tell me. And I see there was no questions for Medicare. I just looking at the chat now, there was no questions for Medicare. Does anyone have a question for the supplemental part? Because I'm going to be moving on to the next thing. Okay, I'm going to move on, and we're ready to move on to prescription drug coverage. So we you know, this is option 1 here. You get Medicare, original Medicare, you get a supplemental plan, which we just finished talking about, and then you get prescription drug coverage. So we're going to talk about prescription drug coverage now. So Medicare Part D, that's what they call the Medicare prescription drug program. And these are standalone private insurance companies that contract with Medicare that offer insurance plans. Now, if you're getting a supplemental plan, you should get a drug plan, and you have to get it separately. If you're a person, and we haven't talked about Medicare Advantage yet, but if you're a person who takes Medicare Advantage, you don't have to get a drug plan. It's included with your Medicare Advantage. And they do have an enrollment period for drug coverage, and it's the same as that original thing I talked about for Part B, that 7-month period around your birthday. That's when you need to sign up for a prescription drug coverage. And the reason you want to do that is because if you don't, you're penalized. So if you don't sign up during your initial enrollment period, you're penalized 1% on your premium for every month that you didn't sign up. So you want to make sure you sign up. And I know there's a lot of people that say, I don't even take prescription drugs and I'm healthy. I don't really want to get a drug plan. But when I counsel people, I recommend that they do get a drug plan, and they find the drug plan with the lowest premium. And next year, it's actually going to be about $7. This year, it was about $14. So get the least expensive plan you can so that you avoid penalties, because in the future, you may want a drug plan. And I've counseled people who didn't get a drug plan when they could have. And like 7-8 years later, they needed a drug plan because now they're on some prescription drugs that are expensive and they're paying a penalty. So you want to avoid that. So I recommend people to sign up for the drug plan and have it, and find the cheapest plan you can at the time, the least expensive premium. You also might be able to avoid a penalty if you have creditable coverage in another way. And that creditable coverage could come like from that employer plan I talked about earlier, where they offered for their employees who are on Medicare. That usually includes a drug plan. Well, if you have a drug plan in there, you don't need to sign up for a Part D plan because you have drug coverage in that employer's plan. And if you ever leave the plan or the plan ends, you can get a Part D plan without penalty because you had creditable coverage during that whole period. Another example would be a VA. Maybe a VA. Maybe you qualify for VA prescription drug benefits, and you'd rather get your drugs through the VA. That's fine. You can do that, and that's creditable coverage. And if you ever decide to leave that because maybe it's getting inconvenient, only going to one. I can only get my drugs from one place. It's getting inconvenient. I want to do something else. You can get a Part D plan, and you would not be penalized. Now, when you have creditable coverage and you're over 65, you usually get a statement from whoever's offering it. Hang on to that. Make sure you have that proof that you had creditable coverage so that when you do need to apply, you have proof that you had creditable coverage. Prescription drug coverage. Now, this is one you can change every year. You know, I want to go, I kind of missed something here. When we were talking about the supplemental plans, I know it's out of order here, but I had a question that came in. Can you change plans every year? Well, with the supplemental plan, you really cannot change plans every year very easily. With a supplemental plan, the only time that you have guaranteed issue is during that 6-month period. Once that 6-month period is over with, you don't have guaranteed issue anymore for those supplemental plans. And if you decide that you want to change companies, you can, and they might take you, but they don't have to take you. So that was an answer to a question that came in via email. I'm going back to drug coverage now. So with prescription drug coverages, you can change the plan every single year. And you should look into it every single year to see which plan is best for you. There's a lot of factors involved with helping decide which plan is best for you. And you use those factors and you pick the best plan. But by next year, that may not be the best plan anymore because either the plan changed or you got new drugs that you weren't taking when you first signed up, and there's another plan that's better for you. So you want to look at that every year, and that's basically what open enrollment is about, for people to make sure that they still have the best drug plan. And that's why we do a lot of counseling during open enrollment. Open enrollment's from October 15th to December 7th, and I can help you with that. You can look at it yourself. And you should review your plan to see if there's any better plans out there. And again, we counsel people quite a bit during this period of time, and I have some counseling dates set up that I'll in ways to contact me if you want to have an appointment. I can show you later on a later slide. I'm going to go on and we're going to talk about prescription drug coverage a little bit still. Here's some concepts I want you to know. First of all, they have premiums. When you buy drug coverage, they do have a premium. The average premium in the United States is $35. There's a lot of plans that are lower. Like this year, the lowest is about $14 here in Ohio, and the highest is about, I think, 85 or 90 here in Ohio. So you have plans that vary, but the average price is $35. Like I said, next year I see there's a plan out there for a little over $7. They also have deductibles. So a deductible is what out of pocket that you would have on name brands only, not on generic. The deductible is what you would pay before your benefit kicks in. So you want to know about a deductible when you're picking a plan and how it impacts how much you're paying. There's also copays. The copays are like flat copays, like $2, $4, $8. Sometimes it's a percentage, like a 25%. So copays vary depending on what the drug is and what the company that you pick is. But you know, these copays are based on a formulary. So a formulary, if you remember, is the drugs that a plan covers. There's about 25 drug plans, or about 27 drug plans here in Ohio this year. And a formulary is what each company covers. Every company has a slightly different formulary. So you want to make sure that the drugs you're taking are on a plan's formulary. You know, you don't want to pick a company where your drug isn't covered. The formularies are pretty extensive, and every plan has to cover all the major diseases and in a bunch of different drugs that cover that disease, but they don't have to cover every drug that covers a disease. That's why you may be taking a drug that's not on a formulary, but it might be on somebody else's formulary. The other thing that I want to talk about are tiers. When you have a Part D plan, the drugs are put into tiers. There's 4 main tiers. Tier 1 and 2 are generic drugs. Tier 1 is like preferred generic drugs, and Tier 2 are standard generic drugs. And a preferred generic drug for that company is cheaper. It's a lower copay than a standard generic drug. And each plan does this a little bit differently. So when you're picking a plan, you want to find a plan where your drug is, if you're taking a generic, that your drug is a preferred generic, so that you have the lower copay. And it works the same way with the name brand drugs. 3 and 4 are name brand drugs, Tier 3 and 4. And Tier 3 is a preferred name brand drug, which would have a lower copay than a standard name brand drug. So you want to find a company where your Tier 3 is, or your name brand drug is a Tier 3, if possible. So those are some things to look at. There's another thing when you're trying to decide which plan is best for you, and that's preferred pharmacies. So all these companies contract with pharmacies, and they have preferred pharmacies, standard pharmacies, or non-participating pharmacies. So you definitely want to find a plan where the pharmacy you like to use is a participating pharmacy, and at best you want to find one that is a preferred pharmacy, because preferred pharmacies have lower copays than standard pharmacies, and each company does it different. They have contracts with the different pharmacies in different ways. So those are all things to look at. And one other thing, I don't want to get into too much detail, but you've heard things like the donut hole and the coverage gap. So I just want to talk about these phases. During the course of the year, the amount that you pay in copay changes over time. Before you reach a deductible, your copay is going to be at a certain level. Once you reach your deductible, it's called the initial phase. Then that's what you pay for that's the discounted price that you pay for your drug. After you get to a certain level of like over $4,000 of drugs that were purchased that year, you reach this coverage gap. And when you're in the coverage gap or the donut hole, you pay 25% of the retail price. So it goes up at that. So at that point, it goes up. And then after you get over $6,000 worth of drug for the year, you reach catastrophic and you only pay 5%. So again, your copay is changing during the year depending on what you're taking. If you're taking like a generic drug, you probably never reach the coverage gap. But if you're taking a name brand drug, you very well might reach the coverage gap and maybe even unfortunately catastrophic. So that's it. So those are the things to keep in mind. And the big thing is like, how are you supposed to figure this out? Isn't this a lot of stuff? Isn't this complicated? Yeah, it really is. And the best way to figure out which plan is best for you is to go onto Medicare.gov. So I talked about Medicare.gov as being a good source of information for you, but it's also has a plan finder in it. So you click on this plan finder and you type in the drugs that you take, you type in your zip code, you type in the pharmacies that you like to use, and then it will do some calculations behind the scenes, and it will tell you how much you're going to pay for the year in premium as well as your out-of-pockets. And then you can compare the plans that way, and you can take a plan that is the least expensive. So it works really, really well. It's a very good program. And a couple ways to do that. One, you can go on to Medicare.gov yourself and do this yourself. And two, you can contact someone like me, and I can help you through that, and I can, do a counseling session and help you through that and show you what plans would be best for you. And then when you're doing these plans, you can actually sign up right there in Medicare.gov, or I can help you sign up in Medicare.gov. And that works out really well too. So that's how that works. And I think that's all I want to say about prescription drugs. And I'm going to go on to Medicare Advantage. But before I do that, I wanted to say there's extra help for prescription drugs also. It's a separate extra help program. And if you're below a certain level of income and a certain level of resources, you might qualify for this and you can apply. And again, if you want to make an appointment, I can help you do that. You can call OSHIIP's hotline and they can help you do this. And we can get that up if it looks like you're close to being at that number. And again, I'm going to stop and I'm going to move on to Medicare Advantage. And if there's any questions about prescription drugs, I will take them now. And I'm looking at my chat. And Amber, if we got any questions, let me know and I'll answer them here. Otherwise, I'm going to just move on. Okay, I'm just going to move on. So we covered all of option one, the Medicare secondary insurance and prescription drug coverage. Now we're going to talk about option two, which is Medicare Advantage. This is the one that you see so many advertisements on TV during this time of year. And mailings for people who are over 65, and in any kind of publication you might look, there's all kinds of advertisements. We're seeing them everywhere. So that's option 2. So option 2 is Medicare Advantage, and we're going to go over that now. So with Medicare Advantage, the first thing I wanted to say is, you still sign up for Medicare. So you sign up for Medicare Part A and B, you pay those premiums. And then you have a Medicare Advantage plan. And in order to be in Medicare Advantage, you have to be in Part A and B. And it's based on service area because they're networks. All right, the next bullet point is, it says it's an alternative to Medicare. So these plans are offered by private insurance companies who contract with Medicare to replace original Medicare. So what does it mean to replace original Medicare? Well, before I told you when you had Medicare under option 1 and you had your Medicare card, you show that to the doctor, he sends the bill to Medicare. Well, in this case, you don't show your doctor your Medicare card, you only show him your Medicare Advantage card. And your Medicare Advantage company actually administers the benefits. So when you have a doctor visit and you're on a Medicare Advantage plan, he sends the bill directly to the Medicare Advantage company and they adjudicate it. And they pay the doctor what they're supposed to be paid according to your plan. And then at that point, the doctor will bill you for whatever your out-of-pocket is. And usually in the Medicare Advantage world, there is out-of-pocket. So the big difference between the two plans is Medicare Advantage companies are usually cheap, oftentimes zero premium, but you do pay as you go and there's out-of-pocket as you go. So how does that work? Well, the government, Medicare, they actually send a capitated amount to the of money to the Medicare Advantage company for every Medicare person that's covered. So when you sign up for Medicare Advantage, your Medicare Advantage company is going to get a capitated amount monthly from Medicare, and they use this money to pay their claims and administer the plan. In exchange for that, Medicare doesn't have to pay the claims anymore. So Medicare benefits because they're not adjudicating the claims, they're not taking claims in, they're not paying claims. The Medicare Advantage company is doing that. So that's kind of how that works. And that's how also you see some plans, they say there's $0 premium. That's why because they're getting money from Medicare, they can charge $0, and depending on the benefits, they can still break even or make money. When you're on a Medicare Advantage plan, there's two types, HMO and PPO. HMO means you need to stay in the network. So each of these plans has a network of doctors, and you need to stay in it, because if you stay in the network when you go to the doctor, they will pay the full benefits. And the full benefits doesn't mean they're going to pay the whole cost. It just means they're going to pay according to the full benefits that are available to you, and there's still co-payments. And if you don't go to a doctor who's in the HMO, you're responsible for the full amount. So it's kind of drastic if you don't go to a doctor. So the thing is here, you really need to stay in the network in order to have your stuff paid for. PPO is similar. It's also a network, and if you go to an in-network doctor, it pays in full your benefits. And if you go outside the network, they're a little more forgiving. They will pay about 60% or 70%. So you only are responsible for about 30 or 40% of the bill if you go to a PPO. So a PPO is similar, but you can go out of network and it's not as punishing. Most of these plans include Part D. I'm just going to say they all include Part D. You could get a specific plan if for some reason you didn't want one. Let's say you're on VA benefits and wanted a Medicare Advantage plan that didn't have it. You can find one, but these do have Part D for you, so you don't have to sign up for Part D. And you're reminded that you still pay your premium. So even though you're paying a zero premium to the Medicare Advantage company, you're paying Medicare the Part B premium. And let's see if there's anything on the next page. There's the initial enrollment period is like the 7 months around when you first sign up for Medicare in the first place. Otherwise, you need to wait for an open enrollment period. And the first open enrollment period for Medicare is October 15th to December 7th. So that, again, that's the same as that Medicare Part D one. So that's coming up. So people can change their plans starting October 15th, which is, I think, tomorrow. Or if you didn't ever sign up before, or if you were going to change from some other thing that you were doing, this would be the time where you would sign up for a Medicare Advantage plan if you wanted to move over to Medicare Advantage. There's also an open enrollment period January 1st through 31st, and that's for people who are already on Medicare Advantage. And you can change at that time, but you can only do that if you're already on a Medicare Advantage plan. It's not somebody who's new to Medicare Advantage. And some concepts about Medicare Advantage that you have to think about. One, there's the networks that we talked about. So when you're going to pick a Medicare Advantage plan, you probably should make sure that your doctor is in the network, or be willing to change doctors. There's also deductibles, co-payments that you have to consider, and each plan does it a little bit differently. So they work it out so that they're similar, but if you have a specific condition, you might be looking for a particular service that you have done a lot during the year, and you'd want to see what their co-payment is on that one. Another really important one, which I look at a lot when I counsel people, I recommend people look at this. There's an out-of-pocket maximum. So, I was mentioning that it's a kind of a pay-as-you-go. So even if you don't have a premium, you're still paying every time you have a service. Well, these plans luckily have an out-of-pocket maximum, so it doesn't go to infinity. If you have a bad health year, once you reach the out-of-pocket maximum, you don't have to pay any more out-of-pocket for that year, and then it starts over again the next year. And the out-of-pockets, the lowest ones are about $3,400, and the highest ones are around $6,000. So they're kind of all over the place. But at least if you reach that $6,000, you won't have to pay out again until next year. And then, another thing about the Medicare Advantage plans is they do include the drug plan. So they have all those factors we talked about with the Part D plans, with the formularies and all that kind of stuff. So it's very, very complicated, and it's hard to decide which one's best. And again, how do you figure that out? Well, Medicare.gov has that information for you. So you can go into Medicare.gov, type in, the information about yourself, and it will rank out and list the plans that are available to you, and you can compare them that way. And again, you can make an appointment with someone like me or the OSHIIP hotline and talk to them, and they can help you with that too. So that's the main stuff about Medicare Advantage. And I think I'm almost done with that stuff, and we're going to just do a final few things to wrap it up here. So we're done with covering Medicare and the different options you have. And remember, it's option 1 and option 2. And right now, I'm just going to do a little bit of overview and just to tie things up. So with option 1, that's mainly getting a Medicare supplement and a Part D plan. They have higher premiums, little or no deductible or copays. There's no specific network, so you can use any doctor in the country. You do need to get a drug plan if you go with this option. And they have to take you during the initial enrollment period. That's a guaranteed issue period. And it's good for people who travel or have serious health conditions when you use multiple doctors from probably different networks. Option 2 is the Medicare Advantage plan, and it has low or no monthly premiums, which is nice, but there's copays for all the healthcare that you get. But the good thing too is it has that maximum out of pocket to limit the amount that you'd have to pay. They do have networks. They're actually kind of designed so they're around like a county. So here in Cuyahoga County, I think this next year there's going to be about 50 plans available. But those plans are just networks for around here in a couple surrounding counties. So it would not include something from Columbus or Cincinnati or another state. These do include drug coverage. And one thing I didn't mention before was that they usually offer, not always, but they are allowed to offer, and most of them do offer, like a dental, vision, and hearing plan. Now, that's not offered in original Medicare at all, but a Medicare Advantage plan can offer that. And then there's some other benefits that they're allowed to offer. Not all of them do, but they can offer like an over-the-counter drug where they'll pay for some of your on account of the over-the-counter drugs, and they will also sometimes pay for like a silver sneakers or gym membership. So there's different things that they're allowed to offer, and often they do. And if those are important to you when you're doing your research on a Medicare Advantage plan, you can verify that the plan offers these things for you. And always have to take you during the initial enrollment period. So you can never be turned down during an initial enrollment period or open enrollment period. So you can, this is one that you can change every year. All right, I'm not going to go over this. This page kind of is just a graph version or a matrix version of what I just talked about. And here I want to do this one because people still want to find out economically which is the best one for me. So I made this chart of what it might look like if you were on Medicare. So I did one for option one, and I just picked a G plan. And with option two, it's a Medicare Advantage. And I picked for the option two, I picked a medical mutual Medicare Advantage plan that's available now. That kind of was a nice representation of what's available. And for the G plan, I just picked a generic G plan. So let's look at what the costs would be. So whether you go with option one or option two, you're going to have to pay $144 premium a month. That comes out to about $1,700 a month, no matter which way you go. So right now, either option is going to cost you the same. Now, the insurance premium, I just picked $150. I would think that if you're turning 65 now, you might find one that's much less than $150, but I just use that as a nice round number that's easy to multiply. So that comes out to be $1,800 a year. With option two, this was a zero premium plan that I picked. So it's zero premium. So right now, option two is looking pretty good. Drug premium, $35. I just picked the average. I don't know, you might find one that's for less than that, but I just picked 35. That comes out to be $420 a year for option one. And option two, it's a zero premium plan, so you don't pay for your drug premium. It's still looking good on option two. And then medical out-of-pocket expenses. Now, if you have a G plan and you have good health that year, you would pay zero out of pocket, which is good. So you have no additional out of pocket. And even if you do have a bad health year, the most you're going to pay is $198 for your out of pocket, for your medical out of pocket, because that's the only thing that's not covered is that deductible. With option two, again, if you have a really healthy year and you're on this Medicare Advantage plan, you might pay nothing out of pocket. However, if you have a bad health year, you could make it up to the out-of-pocket maximum. And for this plan, this medical mutual plan, it's $4,300. So you could potentially pay up to $4,300 out of pocket. So if you look at, and then for the drug out of pocket, I just couldn't fill that in because I don't know what drugs anyone's taking, so I'm not going to fill that in. If you did your own version of this matrix, you'll have different numbers than I have here. And then you will also be able to put in your drug out of pocket to compare which way is the best. But anyways, without the drug out of pocket, if a plan G looks like it's about $4,000, no matter what, whether you have a good year, a healthy year, or an unhealthy year, it's going to be about $4,000. So it's easy to budget because you know you're going to spend $4,000 that year. Option two, if you have a really good year, you might be as low as $1,700, but on the other hand, you might be paying out as much as $6,000. So it's not as easy to budget, but if you have a really healthy year, you definitely save money. If you have an unhealthy year, you pay a little bit more by having a Medicare Advantage plan. So that's just a rough estimate. If you do this yourself, it won't look exactly like this, but for this presentation, it kind of gives a good overview of how that works. We had a question, can I change from plan to plan each year? So let's go over this. There's different ways, different situations. So let's say you picked a supplement. You went with option one, you picked a supplement, and now you want to move to Medicare Advantage. Can you do that? Yes, you can. If you're on a supplement, you can move to Medicare Advantage anytime there's a Medicare Advantage open enrollment period. So that's just during that, remember, that's that October to December thing. But you are allowed to do it anytime. Okay, now you pick the supplement and you want to move to another supplement. I like this supplement. My friend had it. He thought it was great. I don't like it so much. I want to go someone else. Can you do that? Yeah, you can do that. And you can do it anytime you wish, but there's no guaranteed issue. So they may not take you and they may not charge you the same thing that charging everybody else your age. So you can do it, but it's not a guaranteed thing. Medicare Advantage to Medicare Advantage. Can you do this? I picked up, Medicare Advantage plan. Now my doctor moved to a different group. Can I change? Yeah, again, you can change that during any open enrollment period. And that's that October 15th to December 6th. And also this would fall into where you could change between January 1st and March 31st. So that's a very easy one to do, very common one. And then Medicare Advantage to Medicare Supplement. All right, I joined a Medicare Advantage plan. Now I want to go to supplement. Well, can you do that? Well, there's no guaranteed issue. If it's outside that 6-month window for the supplement, there's no guarantee. You can do it if you wish, but there's no guarantee that they will take you or charge you the same thing that they charge people your age. But there is a couple exceptions. One is like that special enrollment period that I have here, and that's like if your other carrier stopped their Medicare Advantage plan and they went out of business, you have a 2-month period to join us anything you want, including a supplement, or your union maybe had a Medicare Advantage plan and they dropped it. You can move to a supplement during that 2-month period without any kind of penalty, and you'd have guaranteed issue. So that's that one. And there was one other thing I wanted to mention about that. There's a thing like a trial period. So if you join a Medicare Advantage plan in that first year, trial period's the first year. If you join a Medicare Advantage plan in that first year and you decide, and this is it's after 7-8 months, but it's still in that first trial period year, that Medicare Advantage isn't for you. I really do want a supplement. Well, you can pick a supplement, and they do have a guaranteed issue during that trial period. And it could also work where you join a supplement. I don't like it. I'm going to Medicare Advantage in the first year. I don't like that. Again, I want to go back to the supplement all in the first year. You could get a guaranteed issue because it was your trial period. I mean, when I advise people, I'd say don't count on that trial period. Just pick the approach that's best for you. But if things go wrong and you made a wrong decision, you at least can get out of it for 1 year. Other than that, you're pretty well stuck with the supplement plan that you pick. Okay, some of the changes next year, the premium is going to be $148. The Part D deductibles up to $445 now. There's some new benefits that Medicare Advantage plans can offer, and they're listed here. Big deal, I guess if you're a kidney patient, end-stage renal disease, they can now get Medicare Advantage. Before that, they couldn't. And then there's a new insulin demonstration project where they're trying to make insulin, I think it's $35 a month. Plans don't have to participate, but they can. And there's a new plan where they're going to offer home infusion therapy services through the Medicare Advantage plans. So I'm not going to go over the unscrupulous sales practices. You've probably heard of these a lot. And you have to remember that they're not supposed to do door-to-door salesmen. They cannot give you out gifts, cash gifts, no high pressure tactics. And if you do have an issue like this, you can call the Ohio Department of Insurance, and the phone numbers are here. And, there are scammers out there. They want to get your Medicare number. So they might do something like call saying Medicare needs to have your information updated. Well, they don't call like that. They either go through Medicare.gov or send you something in the mail if they need any kind of updates. So just hang up. Don't talk to them. Don't give out that information. Or then somebody might say you're eligible for something and they just need your Medicare number. And what they like to do is they'll get your Medicare number and bill Medicare for something that maybe they didn't even do or it wasn't needed. A while ago, they were free medical alert. Just give me your Medicare number. It'll be covered. And Maybe they get it, maybe they don't. There was the DNA testing. People would reach out, like, your DNA coverage, your DNA testing will be covered. They go to a senior center, they take blood from everyone, get their Medicare numbers, submit it to Medicare, get paid for it, and don't give the results. And this year, like COVID-19 testing kits, be careful with that. So only share your information with your doctors, and do not give medical, insurance, financial information to unsolicited calls at all. Hang up. Remember, Medicare doesn't use phone calls for that. And if you want to call the fraud squad, it's here. And by the way, all those different phone numbers that I ever gave you, they're on the back of that Medicare 101 booklet that I can send you in a PDF form. And I think I'm about done here. One last thing, if you do have additional questions, there's a few things you can do, or if you want to have a counseling session for open enrollment, or because you're new, I'd be glad to help you with that. So you can call the OSHIIP Columbus hotline, which is here. And I'll leave this page up for a little bit. You can email me. This is my email, jtlanganship@gmail.com. And I can answer your questions, or we can set up an appointment. And also, if you want to have a private consultation, you can call one of these centers. These are centers that I counsel for. And the way it works now is there's certain days that I'm available to go to these places, and they will give you a time slot, and you can talk with me during that time slot. And during the COVID-19 thing, they're filling in the time slots, but I'm doing them by phone or by Zoom, and they're giving me the names, and I call their name and the number like during the appointed time. So I think I'm done here. I'm going to go back to this page. I'm all done. So if there's any questions, you can ask them now. And let me see if I can do chat and see if anybody has any questions.